Hello, my name is Edith Hamel. I am a researcher at the Montreal Neurological Institute of McGill University in Montreal. And I'm very pleased today to report a little bit on the research that we will be undertaking, basically because we were lucky in getting a grant from the Alzheimer Society of Canada to be able to perform these studies. So I would like to thank you all, the donors, as well as the people who contributed in any way to raising this money and make us basically one of the recipients of this grant. I think that's very important to us. So what we will be targeting primarily in our study is the understanding of why do risk factors, and particularly hypercholesterolemia and diabetes, do increase the risk of developing Alzheimer's disease or vascular dementia with increasing age. So what we will be looking specifically is using an animal model of vascular pathology. So it's an animal, it's a mouse, that has a basically disease of the brain vessel, but to level which is very mild and which could maybe recapitulate what is happening in the brain vessel of elderly people. That means the circulation is not totally normal, but not too severely impaired. The blood vessels are a little bit rigid, stiffer, but they are still able to function. And these animals do not have any cognitive failure, or until they are very, very old. So what is happening then, when we either make these animals hypercholesterolemic or diabetes, and then they actually become cognitively impaired. So we want to understand the mechanism that is underlying this synergy between a diseased cerebral circulation and another comorbid factor like hypercholesterolemia or diabetes to basically lead to cognitive failure. And we will also try to understand if there is a gender susceptibility, if females will be more susceptible than male, as well as if there will be an age-dependent susceptibility. So will the females be more susceptible after menopause than they are before menopause, in order to basically better understand the role of the hormones in protecting possibly women from cognitive failure with time. Also, a question that we will be asking is the drugs that are used to treat hypercholesterolemia or diabetes, are they still able to treat this pathology, but most of all, the cognitive failure that is appearing when we do make these animals that have a little bit of a cerebrovascular pathology, hypercholesterolemic or diabetic, will the drugs used to treat this disease be able to rescue the cognitive failure? So basically, in a few words, that's the research we will be undertaking. I am very pleased that we got this award and these grants, and I hope to be able to report to you in a couple of years of our progress, which I believe will be important mainly for vascular dementia at this point, because the animal model we have is mimicking better vascular dementia, but I do trust that some of the findings may also apply to Alzheimer's disease, because the vascular risk factor that we will be studying are also major one for Alzheimer's disease, for developing Alzheimer's disease with increasing age. So again, thank you very much, and maybe talk to you in a couple of years.